So my name is Ashley Cross.
I'm Shamoli Raval.
I'm Ashley Beck.
I'm Kirsten Geiger.
And I'm Danielle Hibbs.
And we created an expanded healthcare model with regards to acupuncture. We incorporated conventional medicine as well as alternative therapies and how they came together to create complementary therapies. We also included the primary healthcare principles and the Ottawa Charter.
Also, in relationship to our model, we included energetic assumptions as it relates to the person and their professional nurse relationship.
My part was to do the research of the alternative medicine of acupuncture, find out the history behind it and how it's done.
My part was to look at the determinants of health and how they relate to acupuncture, as well as how our model relates to acupuncture.
And I looked at the implications of acupuncture into practice, and I will also be talking about how the model relates to acupuncture.
Okay, so my name is Ashley, and we're here to talk to you about our expanded healthcare project with regards to acupuncture. So I was involved in the creation of our expanded healthcare model, and we're going to go into that a little bit before we get started. So the first part of the model entails conventional medicine. Conventional medicine are medical therapies that are practiced in clinics and hospitals by medical doctors and nurses. In Canada, our healthcare system is publicly funded, and the World Health Organization defines health as the extent to which an individual or group is able, on the one hand, to realize aspirations and satisfy needs, and on the other hand, to change or cope with the environment. Health is therefore seen as a resource for everyday life and not the object for living. It is a positive concept emphasizing social and personal resources as well as physical capacities. And this is our alternative therapies. So alternative therapies do not traditionally fit in the box of our public healthcare system. Alternative therapies are not publicly funded, and people usually turn to alternative therapies when conventional medicine has failed them. The three most popular conventional therapies are chiropractic, massage therapy, and prayer. But we're going to be going into acupuncture with you a little bit later. Alternative practitioners define health as the condition of wholeness, balance, and harmony of the body, mind, emotions, and spirit. It is not a concrete goal to be achieved, rather it is a lifelong process that is characterized by actualization towards potential and a sense of growth and learning. So when we take conventional medicine and alternative therapies, we come up with complementary therapies. Complementary therapies is a use of alternative therapies in combination with conventional medicine, and about 74% of Canadians have used at least one complementary therapy in their lifetime.
So we focused this part of the model of person as a patient. As we are aware that complementary therapies are gaining wide popularity due to numerous reasons, it becomes important for us to understand the energetic assumptions the person views when it comes to choosing complementary therapy such as acupuncture. The first quote, humans are capable of change, transformation, and transcendence. Healing is an internal movement towards harmony and order that occurs in living organisms. This means that people are capable of changing and adapting beyond current reality, which becomes important since in order to understand and use complementary therapy, one must be able to look past the possible interventions besides allopathic medicine. The use of acupuncture also requires the person to balance their flow of energy. Another quote is, human beings are open, complex energy systems rooted in the internal and external environment, co-evolving by interaction and mutuality. This statement believes that the well-being of a person is affected by the environment as well as internally. So, in order to maintain this balance of energy, as required by acupuncture, the person needs to have understanding of internal and external stimulus contributing to such disharmony and imbalance. The other energetic assumption pertaining to person is when in a state of health, energy flows freely through the person in a balanced, harmonious, symmetrical pattern. When in a state of illness, there is imbalance, blockage, or stagnation of energy flow. This statement identifies the flow of energy in a healthy individual. However, in cases of imbalance or illness, this flow of energy is blocked. So, to maintain a balanced energy needs to be brought back to equilibrium.
So, with regards to energetic assumptions about nurses, there are two that we found pertained most to this. The first one is all about mutual participation, where the healer senses the energy level of the healee and is able to access the universal energy field to restore health. In this way, both are blessed by the healing energy. The other one that applied is the life energy follows the intent to heal. Healers can facilitate energy flow for restoration of harmony and order, which basically says that when a person has a genuine desire to heal, the healer is better able to access the energy source and heal the person.
So, when looking at complementary therapy, by focusing on nurse-patient role, it becomes rather important to talk about Ottawa Charter and primary healthcare principles. The first one being strengthening community action is rather important, since in order to accommodate complementary or alternative therapy, there needs to be visual survey of the areas and appropriate clinics in place for people to access such services. By building healthy public policy, we are encouraging use of complementary therapies, which is supported by policies in place for proper utilization of them in healthcare practice. Through creating supportive environment, we are making such therapies more accessible to the public. This goal can be achieved by educating physicians and healthcare providers on these therapies and collaboratively work to refer clients in need to such complementary therapies. We can also develop personal skills by educating people on the complementary therapies and facilitating discussions on prevention of certain diseases if proper complementary therapy is used on time. The last one I believe is very important to establishing and encouraging use of complementary therapies by reorientating healthcare services, because currently strict use of conventional therapy is burdening our healthcare system. And if these alternative therapies are introduced, it can potentially reduce expenditure, since most of these therapies do not have any side effects, which means high quality of life and less symptom controlled drugs being used in healthcare setting. Coming on to next, which is primary healthcare principle, I believe that it fits right into the relationship of client-nurse model, since we as nurses can advocate for shifting of conventional medicine model to more of a complementary therapy model. Accessibility is important, since if people do not have access to these services, there are high chances of failing to shift medicine to strictly allopathic to more of a complementary therapy model. Accessibility also plays a huge part in raising awareness when something is seen more of in a community. It often intrigues the person to find out more about it. Public participation is also important for acceptance of complementary medicine, since accessing such therapies can potentially create need for more clinics. People need to be able to choose the kind of therapies they want in order for such clinics of alternative therapy to be available. Examples include chiropractor, physiotherapist, etc. These clinics are only present since there are more and more people wanting to access these services. Health promotion is an important basis of alternative therapy. These therapies, in conjunction to conventional medicine, can potentially not only reduce burden on healthcare, but also create a more life satisfaction by increasing quality of life. Using appropriate technology is rather important in use of conventional therapies, not only to deliver care to the people, but also keeping up to date with current technologies to help improve their service. In relationship to acupuncture, this also includes proper disposal of needles, policy highlighting the proper techniques to perform acupuncture, and proper handling of patient data while collaborating with other healthcare professionals. Intersectoral collaboration, being the last principle, highlights involvement of all three sectors: government, community, and health. This change to complementary therapy need to happen at government level, where it is being funded or being regulated by governing bodies, involvement of communities in asking for such services in their area, and collaboration of healthcare workers with alternative therapy professionals to deliver optimum care for the clients. All these principles of therapies together can help involve person and the nurse in adapting to complementary therapy as an option in our future healthcare system as demonstrated in our model.
So outside of our model, we have the 6 components of complementary health. The first one is physical health, which entails that when there is optimum functioning of the systems within the body, physical health is present. The 2 critical elements of physical health involve nutrition and physical activity. Next, we have emotional health. The emotional climate that we have in our home, work, or school environment deeply influences our health. Prolonged stress has a negative impact on everyone, especially children. And prolonged stress can also result in physical illness. Next is mental health. Mental aspects include feelings of self-esteem and a sense of value and accomplishment in the ability to create and appreciate aspects of our lives. Our environment should support us in striving for and meeting our developmental, cognitive, and learning needs. The development of a positive concept of self and self-esteem relate to mental and emotional health. Spiritual health. Spiritual health includes factors such as the development of creating moral values, finding a meaningful purpose in life, and the feeling of connectedness with others, nature, and a supreme being. We as adults develop a sense of purpose, value, and meaning throughout life. Environmental health. Our physical environment also has a direct influence on our health. The quality of our air, our water, the soil, and pollution around us all contribute to our sense of health. Last is social health. Positive family experiences that we have growing up help us create strong, affectionate bonds with one another. This serves as a base for creating all of our social relationships throughout life. And this helps us to communicate effectively and encourages us for conflict resolution. So this wraps up our model. Now we're going to discuss how acupuncture applies to this model as our complementary therapy.
So we're going to start with a bit of acupuncture and what it is and how it works. So acupuncture is one of the most commonly accessed alternative therapies. It involves puncturing the skin with thin, sterile needles at defined acupuncture points. These needles are then in place for approximately 10 to 12 minutes, and they'll get a feeling of numbness, soreness, and heaviness at the site. There's 2 forms of acupuncture. You could have manual acupuncture or electroacupuncture. Manual is by the practitioner actually twisting the needles that are punctured into you to produce that feeling of numbness. Or electrical, where the needles are hooked up to an electrical stimulator that delivers high or low impulses. And studies have shown that the electrical one shows more immediate and short-term effects. All of these activate the neural and neuroactive components that are distributed in the skin, muscle, and connective tissues that surround the inserted needle. This creates a neural acupuncture unit that causes a local tissue injury and biochemical reaction. This in return releases inflammatory and immune mediators that have positive biochemical processes resulting in therapeutic responses. So a little bit of the history behind it. Acupuncture was established in traditional Chinese medicine during about BC 400 to AD 1740s. It's been a known therapy for many years in Eastern medicine, and only recently has it come to Western medicine. In 1996, the United States Food and Drug Administration approved acupuncture needles as medical devices. And back in 1991, the National Institute of Health Office of Alternative Medicine was created. So how does it work? By inserting the needles, it creates that inflammatory response, which has been known to balance the flow of energy that is believed to flow through the body pathways to different neural activators. So this boosts your body's natural painkillers and increases blood flow throughout the body. So some conditions it may help. One study showed that chemotherapy is a main use for this acupuncture. It reduces pain, nausea and vomiting, hot flashes, and fatigue. These chemotherapy patients also experience immediate relief and for a period of time after. It has also been known to help with dental pain, fibromyalgia, headaches like tension or migraine, menstrual cramps, labor pain, osteoarthritis, and it's known more commonly for lower back pain or neck pain. Studies have also shown that it has benefits in people with depression. The needles stimulate nerves that in return boost the release of your happy hormones, which are known as norepinephrine, serotonin, and dopamine. And this acupuncture for depression is most effective when in combination with antidepressants.
Okay, so I'm just going to talk a little bit about the determinants of health and how they relate to acupuncture. The 5 determinants of health I found that relate to acupuncture include socioeconomic status, education, health services, culture, and spirituality. These 5 determinants of health both negatively and positively affect a patient's ability and desire to access and utilize acupuncture. Socioeconomic status affects the use of acupuncture as it can be a costly service to access, and therefore people with a lower socioeconomic status may not have the means necessary to utilize this service. In regards to education, it has an impact on the population that accesses acupuncture, as research has shown that the people with lower education are less likely to utilize this alternative therapy. Health services is also a determinant of health that affects the use of acupuncture. This is due to the fact that acupuncture may not be accessible to all members of the population, particularly those living in rural areas where practitioners may not be available. In regards to culture, the use of acupuncture in Canada can be traced back to the 1880s. However, during this time, it was mainly the Chinese population that used it. It has been gradually accepted by mainstream society since the 1970s, and it is now used amongst many different cultures in Canada. Finally, spirituality plays a role in the utilization of acupuncture, as the members of the population that are spiritual are more likely to access acupuncture than those who are not.
Now I will be talking about the implications into practice. So acupuncture is being used to treat many different kinds of illnesses, diseases, as well as their different symptoms. From the research, acupuncture has been shown to alleviate symptoms from COPD, ADHD in preschool children, dysphagia following strokes, and discomfort caused by irritable bowel syndrome. In a study by Suzuki et al., it is stated that all 26 patients showed significant improvement in the Borg dyspnea scale after 10 weeks of acupuncture treatment. This is saying that the participants of the study showed significant improvements in their COPD symptoms after the use of an acupuncture treatment. Researchers Stewarty and McPherson state, overall, the findings suggest that traditional Chinese medicine diagnosis differentiation is relatively more important to the acupuncture aspect of treatment, for example, point selection, than it is to use of the additional therapies or lifestyle advice. In a study by Long and Wu, they conclude that acupuncture might be beneficial in the rehabilitation of patients with dysphagia caused by stroke from their research, meaning that they have found that acupuncture showed to be effective in the rehabilitation of these patients, but further research will be necessary. And finally, in a study by Rajwan, Chacko, and Moeller, it is stated, data suggested that although no participant fully recovered, more participants assigned to the electroacupuncture condition relative to the control condition were categorized as showing more effectiveness and showing improvement, which also indicates a beneficial use for acupuncture. From the research, it can be concluded that the use of acupuncture has been beneficial for the management and treatment of many health issues. However, although there have been positive outcomes for patients using acupuncture, more research needs to go into the effectiveness of this alternative therapy. From this, we can conclude that the use of acupuncture as an alternative therapy could be a significant addition to our healthcare system. And now I will be talking about the application of acupuncture to our model. Allopathic medicine, alongside alternative medicine, yields best results. This statement relates to the complementary component of our model. Our model also includes how acupuncture addresses the physical, mental, and spiritual health components. The intent of acupuncture is to heal, which is related to one of the energetic assumptions, life energy follows the intent to heal. As stated previously, one of the energetic assumptions is also when in a state of health, life energy flows freely through the person in balanced, harmonious, and symmetrical pattern. This assumption is related to the acupuncture, as acupuncture works to balance the flow of energy. Acupuncture also connects to our model through the mental and emotional health component by alleviating symptoms of depression by its release of serotonin and dopamine, as stated earlier. It too connects to the physical health element through the immune response and inflammation process that is activated through the insertion of the needles and aids and eliminates pain in the body.
In summary, we developed an expanded healthcare model that looks at the use of complementary medicine. We looked at the alternative therapy, acupuncture, which can be applied to the model we have created. Acupuncture is a well-known alternative health practice that is useful in treating many conditions and can be implemented into the healthcare system and into our nursing practice. Thank you for watching our presentation, and we hope you enjoyed.